Hello, my name is Amanda, and today I'm here to talk about a major problem in healthcare, the Medicaid coverage gap. This issue affects millions of Americans, particularly in states that haven't expanded Medicaid. These individuals make too much money to qualify for Medicaid but cannot afford health insurance through Affordable Care Act ACA marketplace. This gap has serious consequences. People without insurance often go without the care they need, leading to healthcare problems, financial problems, and a strain on the healthcare system. Today, I'll walk you through what the Medicaid coverage gap is and why it's such a big problem. The three policy options proposed to solve it, and why I believe Medicaid expansion is the best solution. How Medicaid expansion helps healthcare workers and hospitals, and why Medicaid expansion should be a priority for advocacy and health policy. Let's begin understanding the problem. First, we have the coverage gap. The Medicaid coverage gap exists because some states choose not to expand Medicaid under the Affordable Care Act. Medicaid was created to help low-income individuals access health care, but in these states, the eligibility requirements are very strict. For example, a family of 4 is a non-expansion state, might only qualify for Medicaid if they earn less than $12,000 a year. If they earn $13,000, they are left without coverage because they also can't afford a private plan. Here are some real-world examples of how this gap affects people. Chronic illnesses, they go untreated. A single mother with diabetes in a non-expansion state might skip regular doctor visits because she can't afford the out-of-pocket cost. Over time, her condition worsens, leading to complications like kidney failure or even acupuncture. These outcomes are not only devastating for her, but also the cost of healthcare system, much more than preventive care would. In Mississippi, one of the non-expansion states, reports show that nearly 20% of uninsured adults suffer from untreated chronic diseases like hypertension and asthma, which could have been managed with regular care. Emergency care becomes the norm. Uninsured individuals often rely on emergency rooms for health care. For example, a man in Texas, a non-expansion state, might avoid seeing a doctor for a tooth infection when it turns into a life-threatening abscess. He ends up in the ER, costing the hospital thousands of dollars. A study by the Kaiser Family Foundation found that non-expansion states have higher rates of an emergency room visits for preventable conditions compared to states that expanded Medicaid. Financial hardship. Medical debt is the leading cause of personal bankruptcy in the United States. Imagine a family of 4 already struggling to pay rent and buy groceries. If one family member ends up in the hospital, they could face bills of $10,000 or more, forcing them to choose between paying medical expenses or basic needs. These examples highlight how the Medicare coverage gap affects not just individuals, but also entire communities and healthcare systems. Policy option. Let's look at these 3 main ideas to solve the problem, along with examples of where they've been tried. Medicaid expansion. Medicaid expansion allows states to cover people who earn up to 138% of the federal poverty level. For example, a single adult making $18,000 a year could qualify. States like Kentucky and Louisiana have implemented Medicaid expansion and seen uninsured rates drop dramatically. In Louisiana, Medicaid expansion allowed over 500,000 additional residents to get insurance. This led to better health outcomes, including more early cancer screenings and fewer untreated chronic diseases. State funding subsides. Some states like California, have implemented their own programs to help low-income residents afford ACA marketplace plans. These programs work well, but require a strong state budget. For example, California's subsided have helped reduce the state's uninsured rate to just 7%, but they come with a high price tag. During economic downfalls, funding these subsides could become a challenge. Public option plans. A public option creates a state-run insurance plan that competes with private insurers. Washington State's CARE program is an example. It offers lower premiums, but its success depends on whether enough doctors and hospitals participate in its first year. While these policies may have benefits, Medicaid expansion is the most immediate and impactful solution. Why I chose Medicaid expansion. Medicaid expansion is the best choice because it directly addresses the coverage gap and has proven results. It works. State that expanded Medicaid saw their uninsured rates drop significantly. For example, in Arkansas, the uninsured rate dropped from 22% to 9% after Medicaid expansion. Expansion also improves access to prevention care. In Oregon, Medicaid expansion led to 50% increase in doctor visits for low-income individuals, helping catch and treat conditions earlier. Saves money. Uninsured patients often rely on emergency rooms, which cost hospitals and taxpayers much more than regular doctor visits. For an example, a heart attack treated in an ER can cost over $20,000, while preventive care to manage high blood pressure costs a fraction of that. A study found out that states with Medicaid expansion saved an average of $2 billion in unconscious care costs over 5 years. Fairness. Medicaid expansion helps the people who need it most. For another example, Black and Hispanic Americans are more likely to fall into coverage gap. Expansion ensures that they have access to care they deserve, reducing racial disparities in healthcare. Number 2, how Medicaid expansion helps healthcare workers. Medicaid expansion and benefits, not just patients, but also healthcare workers and hospitals. It reduces stress on hospitals. In rural areas, hospital closures are a big problem. For example, in Kansas, several rural hospitals closed due to financial losses from unpaid bills. States with Medicaid expansion, like Colorado, have been able to keep more hospitals open, providing critical care to small communities. They support clinics. Doctors and nurses often feel frustrated when they can't provide care to uninsured patients. Medicaid expansion gives them the tools to focus on long-term health, reducing burnout. For an example, in Michigan, Medicaid expansion improved job satisfaction among healthcare workers by allowing them more comprehensive care. It also boosts the economy. Medicaid expansion creates healthcare jobs. For example, in Louisiana, over 19,000 new jobs were created because of the expansion from hospital staff to community health workers. Number 3, comparing other policies. While state-funded subsidies and public options are helpful, they fall short compared to Medicaid expansion. State-funded subsidies are costly and rely on state budget. For example, during the COVID-19 pandemic, many states struggled to fund even basic health care programs, showing how subsidies might fall in tough economic times. Public option plans. Take these years and setup depend on provider participation. For an example, Washington's public options struggled in rural areas where fewer doctors accepted the plan. Medicaid expansion, on the other hand, provides immediate benefits and has already been tested successfully in many states. Number 4, advocacy and the selling point of Medicaid expansion should be a top priority for advocacy because it's fair. Everyone deserves access to health care, no matter what their income or where they live. It saves lives. For example, a study in the journal Health Affairs found that Medicaid expansion reduced mortality rates by 6% in expansion states. It has public support. Polls showing that over 60% of Americans support expanding Medicaid, making it a strong policy for lawmakers to campaign. So in conclusion, to wrap up, the Medicaid coverage gap is a major problem that affects millions of people. Expanding Medicaid is the best way to address the issue. It helps more people get the care they need, supports healthcare workers, and strengthens the healthcare system. This isn't just about policy, it's about making sure everyone has a fair chance to live by a healthy life. By advocating for Medicaid expansion, we can create a healthcare system that works for everyone. Thank you for listening, and I hope this presentation inspires you to take action. Thank you.